Hi viewers, I'm going to talk about a very important issue as usual, that is about self-harm. It is more sensitive, and about self-harm which is seen in children and also teens. And when I talk about self-harm, people may think that how can a person, that to a child or teen, can harm himself or herself? Will they not feel a bang of pain or something? But then, as you might think, it is very common, and especially nowadays in a lot of stressful situations we are put under, this kind of self-harm behavior is actually rising. I see a lot of such self-harm behavior in teens very commonly in my counseling setup. So how as a parent you could identify this kind of self-harm behavior in your teens or children and try to help them to come out of this. This can be seen as a very complex behavioral problem, and you should know why people tend to choose this kind of self-harm and what is behind it, and why are they even resorting to it in the first place, and is it like an attention seeking behavior, or how as a parent you should respond. Should I ask about it, or if you talk about it, if they feel like am I putting this thought into my in their head, or will they become suicidal? Is self-harm going to be suicidal? Like this, many questions may be in the minds of parents. So this video will answer such questions. So the first thing is how to identify. And before even that, let me tell you like why children and teens especially resort to self-harm for various reasons. Because whenever they see in emergency hospital situations, the major point here is even they may not intend any kind of suicidal behavior or suicidal ideation or suicidal acts, but then they may not even intend to hurt them in the first place, but it might result in any unfortunate situation, even sometimes causing the death of the teen also, or it may even cause some irreparable changes also. So it should be real. It's a very risk behavior, and it has to be identified very early and also treated very early, because at very later stages it would be a little tough to treat this condition. So what is self-harm? So self-harm is when the teens resort to hurt themselves with any sharp objects like razors or blades, or even at the end of the sharp toothpaste, whatever sharp objects they might come across, or even with their nails, or even they may pinch them, or they may even bang their heads, or any kind of self-harm with they can use with their own body parts or with the help of any sharp objects, then it could be termed as self-harm. And they might even use bandage or wear some long sleeve to cover it up. And many parents think that it's my child seeking attention. Maybe this kind of self-harm behavior you could see as after your child has failed an examination or had a love failure or any traumatic stressful situations they are into. And if you think that they are not behaving any normally after 3 to 6 months and continuously they are actually behaving very weird and abnormal, then you need to really check for self-harm. And again, I told you there are certain symptoms with which you can figure out warning signs that your children may harm themselves. You could find some blood-stained band-aid or any sharp objects, or they may be collecting a lot of sharp objects, keeping in their cupboards or in drawers. Somewhere they could be keeping it, then they refuse to come to swimming pool, or even in very sunny situations, they may be wearing full sleeves. Actually, these kids don't want to show their parents because they would generally feel a lot of guilt, and also they may have shameful feeling after this act, because they are just impulsively doing it. They are not like well planning to do this. During such emotionally very overwhelming emotional situations, these teens resort to this kind of self-harm behavior about which they regret later, and they also feel guilty about it. But then most of the times it's not attention seeking as parents may think. So why are they doing? What is the motivation? Mostly this is a result of mental health conditions like anxiety or mood disorders, or as a response to any traumatic situation the teen is actually exposed with. So when they don't know how to handle the distressing emotions, when they are like handicapped to handle their own emotions, they just want to escape from these bitter feelings. So they resort this as a maladaptive coping technique. So self-harm can be seen as a maladaptive or a wrong coping technique they are trying to engage, as they don't know the right method to handle their overwhelming emotions, especially after a very intense argument with their parents, or after any kind of situation as listed earlier. They may resort to this kind. If they are going to be under the locked doors for a very long time, and they are actually very lonely, and if you find or suspect any kind of such behaviors in them, you need to really have a conversation with your teen. And many parents would ask, should I talk about it and all that? But then I would recommend that it's very important that you have an open communication with your teen about this if you really suspect the same with these warning signs I've just listed you. So when you're going to have a conversation, one important tip for the parents is never to react when they say yes, because as a parent, you know your kids' lives are very important to you, needless to say, but then your emotional reaction is going to stop them from revealing the entire thing. So sometimes they may even do the self-harm too, because they may feel emotionally numb as a result of some mental health issues and just want to feel some emotions. Or sometimes the children may feel very guilty and so bad about themselves because of any abuse situations also. Mostly these are the risk factors under which children or teen resort to self-harm. Maybe they were abused, maybe they had some failures, and then maybe they had your mood swings post the puberty. So because of all this, they may resort, underlying conditions may be more complex, like anxiety or depression, as I already told you, or any kind of mood disorders also. So any reasons can be there, underlying causes for causal factors may be there. So first thing, parents, when you're trying to communicate, you should never react but just respond and listen with empathy. And don't try to help them by giving them solutions. You could have told me, you do this, you do that, please refrain from advice. Just listen to them with your ears, don't talk. You have to have a lot of empathy when you talk to them, and sometimes you need to rush them because to the first aid also, and also sometimes emergency also. Sometimes your children may have to be taken to emergency room for treatment. In those cases, again, I know parents, it can be very panicking for parents, but then you can handle the situations and later have a very calm, open conversation with your child. Mostly what kind of teens resort to this is where they are learning it from. Maybe most of the times, majority of the times, one of their friends in the group may also doing self-harm, or they would have seen it in a movie recently, or lot of web series and lot of blogs are talking about self-harm. So these behaviors are learned also from those aspects. When they don't know how to cope, maybe they'll think at least this can resolve my emotional problem, but it's very temporary. Again, they're going to feel the same after some time, and this is not a permanent solution for teens. So what's the next step the parents can do is to take them to a psychologist or a psychiatrist and put them under therapy, and lot of good therapeutical methods are there to handle this problem by understanding the underlying conditions behind it. So therapies like dialectical behavior therapy, which will teach you how to handle these intense emotions. And one major mistakes we as a parents do while the child is growing up is not allowing them to express their emotions at all, because generally we feel these intense emotions should never be felt. So don't be sad, or don't worry, just share up, you're giving everything to you, why are you being sad? These are some comments given by parents so often. So what children goes to believe that I should not have any negative emotions and try to suppress it. And because these emotions were not even acknowledged or validated by their parents while they were growing up, these children tend to have a stunted emotional development and try to feel that, okay, these emotions are not really good, so I need to escape from them, I need to suppress them, I don't want to feel them. So by the time lot of repressed and suppressed emotions are going to take a toll on their child's mental health. So as a preventative technique, parents, please learn that you need to validate your child's emotion, because it's very normal for any child, even any human being, you even as an adult, to have a bad day or feel sad or mad or angry, upset, anxious, anything of sort. It's very common. We cannot always have a rosy day. Think for a while. So when your child is going through that, as a parent, you always want your child to be happy, but then don't stop their emotional expression. It's going to be very dangerous later. Let them express. If they're every day going to be moody, that's a problem. Once in a while, it's fine. So here again, therapy called DBT teaches that we cannot alleviate all the emotions, but then we need to accept, acknowledge, and let go of it. So when they are taught with the right tools of how to handle these overwhelming emotions, probably they will change from maladaptive coping to an adaptive coping techniques. So self-harm can be treated, and this is not a sign of suicide, but then we cannot, we cannot just be ignoring this fact that, okay, this is not suicidal, so my child is safe. It is very important that you need to take mandatory and immediate steps to handle this self-harm behavior, because there might be a lot of underlying problem which is just signaling as a symptom called the self-harm behavior. So this is very common. So by seeing this video, please do spread a word about this kind of self-harm behavior among parents, so that you can detect those behaviors and treat them and intervene them early, so that you can really make your teens life much better and give them the much deserved happiness in their lives. Hope this video was of help to you. So let me catch up in another video. Until then, take care. Have a nice day. Bye.